All right, good evening, everyone. Welcome to our first, welcome to our first, maybe annual, but we'll see. Thank you. Yeah. Oh, do we want the pictures to keep going, or how do we want to?
We can actually ask our ABS to turn down the slideshow once we get.
All right, well, as we're going, as people are coming in, good evening again, and welcome to our great, amazing, beautiful Hopkins lung transplant family. Thank you all for coming tonight, or this evening. I'm Errol Bush. I'm the surgical director of the lung transplant program. I've been here for 10 years, and yes, that probably means I was many of your surgeons if you haven't seen me in a while. And I'm so proud to see so many of you in attendance, and we're expecting even more of you coming as the night goes on. Tonight is really an honor and celebration of you. This is a program or a thought that we've had for many years now, and we're glad that we're finally able to bring it to fruition, to sit here and celebrate with you all. You, and you may not know this, but you are really the inspiration of this program. The resilience that you've shown over the years, just getting to lung transplantation and allowing us to, or entrusting us with your care, has really moved the needle for our program and encourages us every day to work harder and harder to make sure that you have the quality of life that you've expected and the outcomes that you have. So every deep breath that you take is a victory that we all share. Now, I'm going to try to keep this short because I know I'm one of the 8 steps that is between you and us getting out to the reception. So is it okay if I can probably take mine off up here, okay. Sorry, it was getting very hot. And so in order to be, pay honor to time, I just wanted to also send out a great heartfelt appreciation to our staff, outpatient, inpatient, the operative staff that is really taking care of you and really push the needle in our lung transplant community with the research that we do, that we're, again, trying to improve outcomes for lung transplantation worldwide. And many of our leaders are even on consensus groups that are really making decisions or recommendations on the care that lung transplant recipients should undergo, so that they, again, have the best outcomes possible. Now, I mentioned briefly that we've been talking about this event for a while, and when I mean a while, it's 8 years, in fact. And actually, one of our patients had actually reached out and suggested sharing or connecting with the PGA, Professional Golf Association, to have an outing where we would all get together and have a fundraiser to support events like this, as well as all the great research that's going on here. And as you can imagine, that started generating a lot of buzz. The PGA was excited about it, and then COVID happened, and we weren't exactly sure if we were ever going to be able to get together again to share and to celebrate as we are today. But fortunately, now we understand a little bit more about our risk of gathering together, and our experts have weighed in, and now we know that we can do this safely, and we're, again, glad that you're here to share in this moment. But again, we're honored that you've made the journey to come here to celebrate together. And tonight, I just want us all to take a deep breath together and remember and appreciate life, our health, and the second chances that we've all been afforded here to be together and make all of this possible. Thank you very much. So next on our agenda is actually we want to be respectful and reminded of the donors that have all made this possible. And now we have Ms. Latrice Price, who's going to come and reflect on our donors. Ms. Price is the Senior Outreach Coordinator of our OPO, the Organ Procurement Organization, Infinite Legacy. Thank you.
Good evening. Thank you for having me. In honor of our organ, iron, and tissue donors, This evening, we pause to honor incredible individuals who made the selfless decision to give the gift of life through organ, eye, and tissue donation. These heroes and their families have turned pain into purpose, grief into hope, and loss into life for others. Their legacies live on in the hearts and lives of those they touched. We ask that you now join us in a moment of silence to remember and celebrate donors, their families, and the lives that they have changed forever. Thank you.
Hi, welcome, and thank you all for taking the time to travel, to join us in person, and for those of you who are joining us virtually on our live stream, thank you again for joining in as well. It gives me great pleasure to introduce my mentor, professor, colleague, leader, boss, everything, Professor Jonathan Orens, distinguished physician, educator, leader in pulmonary and critical care medicine. Dr. Orens actually began his career really at the inception of lung transplant as a field. Back in 1991 over at the University of Maryland, he really helped establish modern lung transplant as we know it. And he was, not surprisingly, recruited over to Johns Hopkins really to help Hopkins really kind of take off and establish their lung transplant program as well. His clinical leadership, his clinical skills, his expertise really became recognized across the institution, nationally, internationally. And over the next 2 decades, he has had multiple leadership roles within our institution internationally. He was the David Marine Professor and the Director of our Division of Pulmonary and Critical Care Medicine here at Johns Hopkins. He was also wore a hat with the Vice Chairman of Clinical Business and Development in the Department of Medicine, and really helped shape strategic clinical initiatives. Throughout all of this, all of his various roles, leadership throughout the institution, John has never strayed from his role and dedication to the lung transplant program and community. He continues to see all of you guys in a weekly clinic. He comes over to the hospital to check on your patients, as you know, those of you who have been in the hospital have seen and attest to. And he really continues to inspire all of us, patients, colleagues, mentors, supervisors. It's been really, really inspiring. So, John, I'd love for you to say a few remarks, and thank you for all of your leadership.
Thank you, Polly. That was very kind. Let me just turn my cell phone off because I know 100% my grandson's going to try and call right now.
This happens in meeting without fail. 8:55 when our meeting runs late, John does this.
Okay, so I was asked to make a few comments about where we've come from, where we are, where we're heading, but I also want to welcome you all here, and I think that this conference is appropriately named as the Breath of Life ceremony. So congratulations to all of you who have gone through lung transplantation. Also congratulations to all of the healthcare providers, staff, and everybody else who's made this possible. But Polly said a lot of nice things about me, but we stand on the shoulders of giants. And the giants who came before us are the ones that really laid the pathway for this to become successful and for you to be able to get a lung transplant. The very first successful heart-lung transplant was performed by Norm Shumway and Bruce Reitz at Stanford University in 1981. But before that, in 1963, the first attempt was made in Mississippi. And that attempt it didn't work very well because the patient only survived for about 18 days. And that was because we didn't have the kind of immunosuppressive drugs that we have today. After that attempt, there were 40 more attempts at lung transplantation and heart-lung transplantation until it actually became successful in '81. And it was actually felt at one point that we'll be able to do kidneys, we'll be able to do livers, we'll be able to do hearts, but lungs are just not going to happen. And from the work of Norm Shumway in the lab And from the work with Bruce Wrights, it became a reality. So this is James Hardy in '63 who performed that first transplant. Bruce Wrights, who actually was on the faculty here at Hopkins for a period of time in the early 1980s. Joel Cooper was probably one of the most innovative thoracic surgeons. He was the one who gave us the first successful isolated lung transplant, a single lung transplant in 1983 in Toronto. And then he did the first double lung transplant also in Toronto in 1986 before he moved to WashU out in St. Louis. And Vaughn Starnes out in California was the first to do what was called a living lobar transplant, where they took a couple of lobes from parents into young CF patients. That operation has kind of fallen out of favor, but it was successful. If you look back, so Polly mentioned when I first started in the early 1990s, we only did about 600 lung transplants worldwide back then. It was really an early field. And it has grown significantly over the years. This slide's a little bit old, but we actually have sort of peaked out at about 4,500 lung transplants per year worldwide. So it's still a procedure that is relatively rarely done around the world. This is Glenn. Glenn was the first double lung transplant in the state of Maryland. And we did him when I was over at the University of Maryland with John Conti. It was a successful transplant. It was so successful that he actually left the hospital in 5 days, believe it or not. So for those of you who have been through this, you know what that means. And but Glenn was incredible, because 2 months later, I got a phone call at about 3 o'clock in the morning from somebody very, very nervous. You could hear the phone shaking on the other end. He was in Park City, Utah, and he went skiing. He was at 10,000 feet, and he developed high-altitude pulmonary edema. And so I had to walk them through what to do with this fresh lung transplant who should have been home caring for his transplant. He did very, very well for many, many years, and has always been an inspiration to all of us. This was a newspaper article about his journey back in 2000 in the Palm Beach Post. There are a number of contributions that our team has made collectively over the years, and I think it's just worth noting some of these. Between 1999 and 2000, we described our experience transplanting primary and what we used to call primary and secondary pulmonary hypertension, and we were actually, in those days, we got pretty good at it. In 2003, we described the use of azithromycin to treat chronic lung allograft dysfunction. In those early days, when lung function started to deteriorate, we had nothing in the armamentarium that would help. And it finally became apparent that azithromycin had some anti-inflammatory properties, had antimicrobial properties, maybe has some pro-motility properties on the esophagus to help food move through. Be that as it may, they were using this drug in cystic fibrosis patients. And it just so happened that we had our clinic next door to the CF clinic. And we learned about the azithromycin story, and there were a lot of things about chronic lung dysfunction that made us think about cystic fibrosis. And so we tried it, and the first 6 patients we gave it to, the lung function went way up. And we were really shocked by this because we had never seen anything like it. Long story short, about 40% of patients with chronic lung allograft dysfunction respond to azithromycin. And so this has really sort of changed the paradigm of how we treat this problem worldwide. In 2004, we participated in a very important NIH consensus conference on surrogate markers for following chronic lung allograft dysfunction. In 2006, we had the privilege and honor of first authoring the revision of the international guidelines for the selection of lung transplant candidates. And in 2006, we described our experience in treating patients with scleroderma, lung disease, with lung transplantation, which had really not been done before. In 2006, we joined the Lung Transplant Outcomes Group, which is a multi-center program to study the risk factors for primary graft dysfunction, which happens early after transplant, and also for chronic rejection and assessing long-term clinical outcomes. And that group, which consists of about 12 different sites around the country, spearheaded at the University of Pennsylvania, the publication record has been really fantastic, and lots of new insights from the work from that group. In 2009, we talked about the impact of lung allocation score and survival after transplant. That was work that Dr. Merlot did. And in 2011, we published on the impact of lung size mismatch on the outcomes in lung transplantation. That was done by Dr. Eberlein and Dr. Brower. We then learned a little bit more about interstitial lung disease and the association with short telomere syndrome, and we started transplanting patients that had this problem. And we published on the outcomes of those patients and things to think about in selecting candidates. And between 2015 and 2025, some of the most important work that we've done has been in the Genomic Research Alliance for Transplantation, also known as GRAFT, which is a multi-center consortium to study cell-free DNA and molecular injury, developed by Hannah Valentine and Sean Agbar at both the NIH and Johns Hopkins. This work has really changed the paradigm for how we monitor lung transplant patients. In my early days, if somebody came in with any kind of problem where the lung function was dropped, we went right to bronchoscopy. And for those of you who've been through that, you know it's not the easiest procedure to go through in the world. So it turns out that now with cell-free DNA, where we can actually measure DNA being leaked from the transplanted organ into the blood, we can actually quantify that, and we know whether or not there's a problem with the graft, in which case then we have to do a bronchoscopy. But if the cell-free DNA is not high, maybe we don't need to do it. Sort of depends on other clinical factors. This is changing lung transplantation worldwide. So this is our team, and I think all of you in the room know the team. It takes, as has been coined in the past, it takes a village. But I have to say, I've been doing this work now for over 30 years, and this is among the most dedicated group of individuals I've ever worked with. So I want to give a shout out to our coordinators, our staff, and our healthcare delivery. Thank you. Thank you for your work. So, it's great to talk about what was and what can be. And I've always loved this picture of Antara and Arjun. This was the 5-year anniversary for Antara, who's here in the audience. Antara, raise your hand somewhere. Where are you? There she is, way in the back. Okay. So I'm delighted to say that it's 17 years now, Antara? 17 years. God bless. But Antara is sort of, depicts what we deal with. She was so sick going into her operation, we almost couldn't do it. And in fact, is it okay if I divulge a little bit? Okay. In fact, on induction with anesthesia, she had a cardiopulmonary arrest. And Dr. Conti, who was the surgeon at the time, jumped in there, opened her chest, got her on heart-lung bypass, did a heart-lung transplant on her. And she did very, very well, as you can see. So we're very, very proud of Antara, and she serves as an inspiration for all of us. And it's with that inspiration that we get up every morning and are excited to come to work and excited to come take care of you. And I thank you for your time. Oh, I'm supposed to do one more thing. So actually, I think I was asked to have Julie wanted to step in and say a couple of things, and then I'll do my next task.
Hi, everyone. I'm Julie. For those of you that don't know me, I'm one of the post-lung transplant coordinators. I see plenty of familiar faces, though. So just from all of us nurses, it's so good to see you all here. We have not been able to do this in years. So it's really a privilege. And my coworker, Susan, says it best. You all truly teach us the meaning of resilience and gratitude. So thank you for everything you guys put into this. It's a delight to work with you and get to know you as family. And it's really great to see you enjoy all these milestones, grandchildren, weddings, trips you thought you might not be able to make. So keep doing what you're doing, and it's really great to work with all of you. So thank you.
So I think now we're going to have some patient recipient comments, and it's my pleasure to introduce Judith Elburn, who is one of our star recipients, who comes running into the clinic all the time saying, I'm going to do everything you say, and I'm going to do it exactly how you say it, and she has. So Judith, please.
Hi, everybody. Good to be here and see all these familiar faces. So I only have 2 minutes, so I got to get right to it. In 2021, I was diagnosed with IPF. It's like a bird striking a window. The news really had us stunned. When I met with the team of Johns Hopkins doctors, complete strangers at the time, their straightforward, expert explanations made it clear that without a lung transplant, there was really no positive outlook. The initial stages of shock and denial were overwhelming. Receiving the diagnosis transformed my sense of time, shifting my focus from hopes for years ahead to conditional moments. Will I get to hold my daughter's first child? Will I be able to teach all my granddaughters the value of setting a beautiful table? Will my husband, Pat, and I experience Greece together? My health declined quickly as IPF progressed. August 2023, 2 years after my diagnosis, I was placed on the transplant list, a milestone we celebrated while embracing the reality of what was really about to go down. Pat and I had our bags packed like expectant parents, but instead of waiting on my uterus to call, we were waiting for UNOS to call, the United Network for Organ Sharing. Each unknown number brought a rush of hope and anxiety, and when the call finally came, I almost found myself saying, no, I'm not ready. But after 2 dry runs, the third call came while I was having a facial. This is a small act of self-care ahead of the holidays. This time, confidence replaced fear. I trusted that Dr. Bush would approve the lungs and that I'd emerge with more than just glowing skin. Terror and excitement struck at once as I said goodbye to my family and was wheeled to the operating room. My memory of the immediate aftermath is hazy, but I'll never forget the sensation of breathing room air on my own, untethered by plastic tubing, my mind totally present. It just happened to be Thanksgiving Day, and my skin was glowing. Transitioning from the pre-transplant journey to post-transplant life is a major shift, one that calls for a pause, a breath, yet demands intention to move forward. What I have learned is that courage and fear can coexist. You can be scared and still be brave. The initial first year of recovery involved weekly pulmonary fibrosis testing, monthly bronchoscopies, an average of 29 pills a day, a fundoplication procedure to protect my new lungs. On the eve of my 1-year transplant anniversary, I was admitted for several days in the hospital to treat the CMV virus, which is really Satan himself. After another hospital visit to treat lung rejection, COVID, and the flu, and oh my God, the fatigue that came with it. Yet through all of it, with my family, transplant team, humor and grit, we persevered. Tonight I feel only the fatigue of jet lag. For it's an easy price to pay after traveling to Italy, Croatia, Montenegro, and Pat and I made it to Greece. So I walked and climbed, and according to my Apple Watch, I averaged 18,000 steps and 32 flights of stairs. Each step taken with gratitude and humbled that we've made it this far. My post-transplant experience has been a daily miracle, I did witness my daughter give birth to her first child, watched my son's daughters go off to school for the first time, and celebrated my stepdaughter's wedding. Being an active grandmother to 3, soon 4 granddaughters is a role I cherish the most. I have silent moments, again, of gratitude when they make me run, lift, bend, swing, jump, and repeat without being tethered to a hose and watching my oxygen tanks tank. Also important to me is I have taken on the role of mentor with the lung transplant program, walking alongside those new to transplant and offering support is a privilege. Genevieve Ackerman, if you're watching tonight, you've got this. You've totally got this. Throughout my recovery, I've faced both physical and mental challenges, but I've also discovered the immense grace of truly living again. Today, I think less about oxygen levels and more about living life to its fullest. My thoughts are deeper, my gratitude profound. Initially, post-transplant, I felt pressure to find some grand purpose. Like what I've learned is that purpose can be found in just being present. Showing up, comforting a child, helping one person. Instead of clinging to my old self, I asked the harder question, who am I now? And that took courage. Living this miracle is a continuous journey. If you are post-transplant, pause and let your breath remind you of the gift of being here. You have been chosen. So my 2 minutes are up, but I can't let go without expressing my gratitude. First goes to God, the doctors and coordinators, Terry and Julie, whose expertise and tenacity gave me this life. Even when their advice was difficult to hear, I'm thankful to my fellow transplant recipients and support group members who focused only on celebrating positive milestones, and to my family and friends who simply showed up. My deepest thanks goes to my husband, Pat, this is hard, who cared for me with unwavering devotion and love, and who saw and smelled things that I wouldn't wish on anyone. Above all, I'm eternally grateful to my donor and their family, whose loss of life gave us life. Every activity I undertake, untethered from an oxygen tank, is a silent tribute to them, and this is for them. And apologies for my length of talking. I can do that now because I can breathe.
When they asked Judy to speak, they asked me to speak for caregivers, and I just have a couple thoughts. I won't be as long-winded as she is. My caregiving journey changed my life as profoundly as the transplant changed Judy's. Despite all of our preparations, nothing could truly prepare us for the process. The transplant support group became a lifeline. Listening to other stories brought comfort and reassurance to both of us. We had plenty of sleepless nights when we were placed on the list, going nowhere without our phones turned up on the highest volume. Fast forward, after 2 dry runs, we got the call, and we knew what to expect, kind of. Surrounded by friends and family, I faced a 12-hour surgery sitting in the waiting room, and then an overwhelming recovery with daily wound care, medication adjustments, constant monitoring, and establishing a routine, even though my early morning patient wasn't really happy with the early morning routine. We managed to get through it. In the first 3 months, I really never left Judy's side until things stabilized. I found time to revisit my routines and interests. Some things I recommend to all caregivers. Taking breaks is important for both you and the patient. Everybody needs a vacation. She needed a vacation from me more than I needed from her, probably. When asked to speak tonight, I started reflecting on our journey, and I recognized major adjustments we've made and the resilience we've built. Trusting available resources and each other's helped us get through all the highs and lows. Our lives changed, but caring for these new lungs, it hasn't been a burden. It hasn't been a chain that's held us down. We've been out on our boat, we've been on motorcycle rides, enjoying active time with our family and friends, traveling and chasing the granddaughters around, masking and disinfecting along the way. I would also, along with Judy, like to thank God and for what he gave to the doctors and their team, the nurses, and everyone on the staff. Their expertise, their endless commitment, and their commitment to changing people's lives. I'm deeply appreciative for my family who constantly offered help and maintained family traditions during Judy's recovery. Also to our friends who've supported us through all the challenges and the little simple things. And mainly, I'd like to thank the real heroes, and that's the donors and their families. Not just one of us, but both of us have been given a new lease on life, and we're going to live it to the fullest. Thank you.
Thank you, Judy, and thank you, Pat, for those beautiful words. To continue on the theme of the mentor program, I do want to introduce our next set of speakers, John Willie and Jonathan Gersh. John Willie had his transplant in 2018, and Jonathan Gersh is actually the care partner of one of my patients, Alice Gersh. Both of them have taken a huge amount of initiative in supporting all of you in individual mentorship and actually starting our own patient support group here at Hopkins. Really, they do it all. Julie sends out a monthly reminder to sign up, and beyond that, they have really taken off and really provided a wonderful resource that we are so grateful for. So without further ado, I will hand it over to John and John.
I'm the John Wiley of the John and John team. I had my double lung transplant here at Hopkins in 2018. A year later, I was recommended to be a mentor in the Lung Transplant Mentorship Foundation. As a mentor, I work one-on-one with pre-transplant patients as they embark on this emotional journey. The Lung Transplant Foundation provides extensive training before you go out as a mentor. Training stresses listening. Hard to do for some people, me included. I have worked with people from various walks of life. My initial communication with a mentee establishes how we want to communicate. Do we want to talk on the phone? Do we want to do email? Do we want to text, etc.? I encourage the mentee to ask questions. A few common questions that I'm asked. Number one, once I'm listed, how long is it going to take before I get my transplant? I'm guessing the doctors probably were asked that once or twice. Can my caregiver stay with me overnight in the hospital? Will I need oxygen? I share my experience, but I always stress communication with the medical team to ask medical questions. Typically, I communicate with the mentee 2 or 3 times a month, more if requested. I share what helped me when I was in the hospital post-transplant. I kept pictures of my family on the wall. I insisted that staff explain to me, what are you doing? If you take a blood pressure, what was it? If you're doing a blood draw, what is the blood draw? What are you doing? Keep me informed of what's going on. I insist that the staff explain, I'm repeating myself. Be your own advocate. At times, you have to be. I'll give you an example. When I was in bed in ICU, a doctor came in and didn't have a mask on. I asked them if they kindly would put one on before they came to my bedside. So don't be afraid to be your own advocate. Don't be afraid to ask for help. Many people, myself included, They didn't want to ask for help. But people want to help you when you're in this position. All you have to do is ask for it. Write down your questions. So when the docs come in the room, you know what questions you want to ask. The nurses come in the room, you know what questions you want to ask. To this day, when I go into clinic, I bring a list. And after I go through everything with my nurse and with my doctor, I get my list out and ask my questions. Stay in your best physical shape. The many and I express the importance of caregivers. I was very fortunate that I had two. My wife, my daughter, who both happen to be nurses. I'm very passionate about this program, the mentorship program. I know it is helpful to the mentee and to me as the mentor. It gives me a feeling, I guess you could say, of giving back. You can find information, if you're interested, about the mentorship program at lungtransplantfoundation.org. That's lungtransplantfoundation.org. And lastly, my heartfelt thank you to Dr. Bush, Dr. Merlot, my donor, my transplant coordinators, and the entire medical team and staff at Johns Hopkins for saving my life. Thank you.
Hi, everybody. This will be better. Hi, everybody. I'm John Gersh. With John, I am also a lung transplant foundation mentor. My wife, Alice, had a single lung transplant here almost 10 years ago. And a few years after that, Dr. Shah asked us if we would consider being mentors with the Lung Transplant Foundation's program. And we signed up for that, and are really glad that we did. Alice, I think, was Dr. Bush's second transplant here, I think. So we've been with the program for a long time. John talked about the mentorship program in general and about what's involved in being a good mentor. I can add a little bit about what that is from the caregiver point of view. I was also the lead caregiver mentor for the program for a while. And what I'm saying has to do with what I saw all those other mentors doing as well as myself. Let's see, how many caregivers are there here today? Great. And you all know that the challenges that a caregiver faces are very different from those that a patient faces. And therefore, being a mentor for caregivers is different from being a mentor for patients. There are lots of other issues that come up, issues of the workload of being a mentor, family dynamics, other pressures, and the emotional demands that are placed on a caregiver. So a caregiver mentor has to help people through all of those things. Deal with those emotional demands as well as the physical ones. My experience, I've mentored caregivers all across the country and even overseas, and they're all different. They all have their own different situations. They have different resources they can call on. One thing I try to get across, and the caregivers here know this, and it's what Alice and I really learned, was that it's a team effort. Not just the patient and the caregiver, but all the people around them. And that's one thing I try to get across, that you're not alone in this. Being a caregiver makes demands on you, but it's okay to ask for help. And there are people around you who can do that. John mentioned one aspect of being a caregiver, that you have to take care of yourself. And that's one of the major lessons that a caregiver mentor has to get across. That you're not going to be able to help your loved one if you have no energy, you're depressed. You need to do all the things that you can to take care of yourself so that you can provide care to your loved one. And it's easy to forget that because you want to do everything that you can and not spend time taking care of yourself. But that's also part of the team effort, the people that around you that can help you. Another point, and I'm sure the caregivers here know this, actually everybody here knows this, is that being a caregiver is a remarkably rewarding experience. It's easy to lose track of that when you're in the midst of all the daily details, but in the end, it's one of the best things you can do for somebody and one of the best things for a relationship, to be able to go through that experience together. I also want to mention, excuse me, the lung transplant support group. Thank you very much for the shout out. I think, Patrick, you said that. The Lung Transplant Foundation sponsors the Hopkins Connection support group for the lung transplant community. John and I and my wife Alice have moderated that. But the moderation is a pretty easy thing to do because most of the discussion in the support group is among the people there. We can try and guide it. We can sometimes specify topics to talk about. Sometimes we bring in guest lecturers. But it is a group, and that's what's really important. It includes both pre- and post-transplant patients and their caregivers. And one of the things that we really like to hear, and happens a lot, is that somebody will come in for the first time who's a little anxious about this transplant journey. They don't know what's involved. They don't know what the end of it is going to be. And at the end of that session, they would usually say, I feel a lot better now. Now I understand what's going to happen. Now I'm willing to take this journey that you've all done so successfully. So we meet the first Tuesday of every month at 7 p.m. on Zoom. And Julie, where's Julie? There's Julie. She puts out a message in my chart a few days before that, reminding people that it's going to happen, and gives a link to the Zoom meeting for that. Now, I want to end by asking how many people here, another question for the group, how many people here are part of that support group or have been to meetings? Thank you. And I really mean that thank you, because although John and I and Alice have done the logistics and done the moderation for these meetings, it's the group that supports each other. And it's you guys that make it work. So I want to thank you all for that and invite everybody else that's interested to join. You can talk to John or me about it, about the support group program. And I was also asked by Dr. Shaw to mention that the mentoring program has some brochures that are available out in the sign-up area. So if you're interested in the mentoring program, you can pick one of those up. You can also talk to anybody, John, me, other people that have spoken who are part of the mentoring program. And we hope you'll all be able to come to the support group meetings and support each other, which is the point of all this. Thank you.
All right, I'd like to introduce our next speaker, Ms. Judith Garcia, who is a 2023 recipient and will share some words of her journey with us.
Good evening, everyone. My name is Judith Garcia, and I'm a double lung transplant recipient. I had my surgery on April Fool's Day, April 1st, 2023. For me, it was Palm Sunday, so I consider it a double blessing. And first and foremost, I want to thank my God for helping me get through this. I want to thank my donor and his family. And I want to thank Dr. Bush and the entire transplant team at Johns Hopkins, all the nurses, everyone. They treated me with so much respect and dignity and sympathy, and they helped me out with anything that I needed. And I was diagnosed in 2016 with IPF, and I must admit, when I was first told that I had this, I went into a really dark place. I didn't know what to do. I didn't know. It took a while for me to take it in. And unfortunately, I was working during that time, and I was forced to take an early retirement because I am a dental hygienist. And so when all of that happened, of course, I lost everything that I worked so hard for. And anyway, I started my journey with Johns Hopkins, and I went through all my evaluation exams, and thank God everything went well with that. It was a rough journey. It was really rough because towards the end of the journey, before I had my transplant, I couldn't even take a shower because I was so short of breath. I mean, it's like I had lost my total independence. And I cried and cried. I was so depressed and sad with all of this, up until the point where, because at first I was against the fence about the transplant. I'm not going to lie about that, not knowing, exactly what was going to happen or what to expect. But after doing my research and joining the support groups, I learned a lot from other patients that had been transplanted. And I said, okay, well, I guess this is it. And so I wound up coming into the clinic one day on March 9th for a follow-up appointment, and during that time, my breathing was getting really bad, and I couldn't pass my PFT tests. And so Dr. Shaw said, Ms. Garcia, we're going to be admitting you today. I was like, huh? She said, yeah, unfortunately, I didn't even stay a minute for the PFT. That's how bad I was. And they took me upstairs. They put me on high-flow oxygen. 9 days after that, thank God, I was listed. And then 8 days later, I got my transplant. And here I am 2.5 years later. And again, I'm so grateful to all the Johns Hopkins doctors and the nurses there. And hey, I love you guys. And good luck to all the people that are waiting, okay? And just hold on to your faith and be strong and do exercise and live your life to the fullest. I'm so glad that I did this. If I had to do it again, I would. Thank you, everyone.
All right, thank you, Ms. Garcia, for sharing those wonderful words and of your journey. Next, we'll have another one of our recipients come, but she's also our very long title, Physician Liaison Outreach Navigator, I think is all of it. And many of you received messages from her with the invites for today and reminders, and probably more reminders than you really wanted. But we're glad that you're all here, and we're very looking forward to hearing the story of sharing of the story from Ms. Brianna Medley.
Hi, everybody. My name is Brianna Medley. I am a bilateral lung transplant recipient from June 2019. Blessed to have been under the incredible surgical hands of Dr. Errol Bush and the wise care of Dr. Polly Shaw, along with the entire team of the nurse coordinators who became pretty much my second family on speed dial. First and foremost, I want to thank the Hopkins team for putting this event together. It is so much more than a gathering. It's a true celebration of life. A celebration not only of us as recipients, but also of our brave donors and their families, without whom none of us would be here. Their selfless gift is the heartbeat of this room today. My journey began at a very young age. As a baby, I battled bronchitis often. Growing up, my dad owned a landscaping company and stored pesticides, materials in the basement directly below my bedroom. For years, I unknowingly inhaled those chemicals. Later in my teenage years, we had parakeets in the house. That's when the first real signs began to surface. I was an athlete, I ran track in school, but in my senior year, I noticed that no matter how hard I trained, I couldn't catch my breath. At first, I thought it was sports-induced asthma, but as doctors ran test after test, things only got more serious. Eventually, the diagnosis came: hypersensitivity pneumonitis. Translation: birds and I were officially no longer friends. This is where the amazing Dr. Sonia Danoff entered my life. She guided me for 6 years, and I can say that with absolute certainty. If it wasn't for her early intervention, I would not be here today. In the middle of all this uncertainty, I met my now husband, Mark. Even before marriage, he carried me through some of the hardest times, driving me to countless appointments, sitting with me through long days in Baltimore, and finding ways to keep me sane when life felt overwhelming. I don't think he knew then just how much the years ahead of us would test us, but he showed up with love and faith every single time. Amidst the chaos, I made what some might call a bold choice. I enrolled in nursing school. Who better to learn about lungs than someone living the textbook every day? While others carried notebooks, I came with pulmonary function tests. And while it wasn't easy balancing admissions while in school, chest tubes, and endless hospital stays, it felt like, I refused to let that illness steal my dreams. By 2019, it was clear my time for transplant had come. On top of everything, Mark and I had been planning our wedding, but life had other plans. My health was failing quickly, and instead of walking down the aisle, we canceled our wedding, and I walked into the NPCU to wait for new lungs. The first call came, and my whole family gathered, ready to send me off, but it wasn't time. Disappointed, yes, but I trusted the process. I trusted my team, most definitely. I knew I needed the right lungs, not just any lungs. Finally, on the third call, it was my moment. I don't recall much after surgery. It was a bit hazy. Just the nurses telling me, calm down, Brianna, it's okay, you're safe. Safe, that word still resonates with me because from that moment on, I felt a safety I hadn't known in years. And slowly, I began to soar again. The team that cared for me didn't just save my life. They lifted my family, carried my husband through his fears, and held my hand until I could hold my son's. I will never forget the faces, the compassion, and the skill that gave me my second chance. 1 year later, I walked across the stage with my nursing class and graduated. Lungs full of air, heart full of gratitude. Soon after, I became a nurse at Hopkins myself, hoping to give back just a fraction of what has been given to me. Then in 2023, my biggest miracle came, my baby boy, Micah. In the lung transplant world, that is not just rare, that's almost unheard of. But I always had faith, and I will continue to have faith no matter what trials come my way, and there has been quite a few. I am grateful beyond words to my Lord and Savior Jesus Christ for sustaining me, to my donor, her family. Meeting them was incredible, for their unimaginable sacrifice, to my husband for never letting go, and to my son for being the living reminder that life after transplant is not just possible, it's beautiful. This journey has been nothing but easy. It has been full of valleys and peaks, heartbreak and joy, but every breath reminds me it is absolutely worth it. My prayer is that life continues to honor the gift I've been given and inspires others to walk in the same path. God bless, and thank you for letting me talk.
Brianna, thank you for that beautiful words. As I'll say, that as you mentioned, folks who put the event together, Brianna, that was you. So thank you for being here for all of it. For our final transplant recipient of the evening, I wanted to introduce Sarah Pierzak. Sarah started her journey quite some time ago, actually before I even came to Hopkins. I think I first met her when I was a fellow in training. She was under the care of my mentor, and I enjoyed coming to this clinic so much and was so inspired that it became my field. So without further ado, Sarah, come on up and love to hear from you.
Thank you, Dr. Shaw, for that really kind introduction. Hello, everyone. It's wonderful to be here tonight and to be alive and breathing, right? Right. Okay, so in celebration of that, I'm going to ask us to do something that might be uncomfortable or scary for some of us still, but it's going to be okay. We're going to take a moment to appreciate our bodies and lungs as they exist right now in this moment. We're going to do it by taking a breath together, okay? We're going to put our hands over our hearts. And no matter how fast or slow or iffy it might be beating right now, it's okay. So breathe in, no counting, no holding, and out. Breathing in this special moment together with our team, our loved ones, and a room full of people and online who have been through, are going through, or some way, this journey in some way, shape, or form. One more time, in and out. Thank you. That was really nice. Are we all here? Okay. I'd like to add a quick aside. The last time I spoke at something like this was like 20 years ago, and nobody remembered a single word I said. But they did remember me chasing my then 3-year-old son down the aisle because he made a run for it. I asked him if he would come along to recreate this moment in case I flop. But he said that 1, it wouldn't have the same charm now as it did when he was little. 2, he's busy doing things like going to college, working, and jumping out of perfectly good airplanes. And 3, if I was struggling with writer's block, some push-ups would help. Spoiler, they did not. So here we go. As of today, I am 21 years, 5 months, and 2 days post-double lung transplant. I'm so surprised to be here too, so. My transplant has not only allowed me to be here, but it has blessed me with the ability to watch my kids blossom into remarkable adults. My husband morph into a silver fox. And it's also afforded me, this gift of time has afforded me some space to reflect on my journey, the larger transplant experience, and how we all fit together. Because none of us goes through life in a vacuum. We touch. And our stories become woven into this fabric of multiple lives, and it becomes, in essence, our joint history. First, let's look at the personal. The transplant experience is unique in that it both shrinks and expands your life in ways I never thought possible. Sometimes your scope, especially pre-transplant, is as narrow as a breath, focusing on getting just enough air to make it through the moment, to calm your racing heart, to center yourself in the here and now. It's chanting, I'm okay, I'm okay, I'm okay, to yourself so you don't panic, to calm your nervous system. It's waiting until visiting hours are over and you're alone to look at that new surgical site in the mirror to adjust to yet another new normal. Whoosh. But it's forcing you to delve deep into yourself, into parts that you didn't even know. Maybe they didn't exist until you needed them. But it's also taking your kids for a walk for the first time post-transplant on a beautiful day. It's earning that degree you always wanted. It's holding your person's hand in the car when you go on an adventure. Or to Lowe's. Again, life's about balance. But it's also learning to trust, to open yourself up and rely on those around you. And this is where our joint history begins. It's discovering the strength of your family. A husband who rocks you to sleep when you hurt or you have anxiety. A sister who makes you laugh so hard that pre-transplant she would have to leave the room just so your O2 sats can recover. It becomes fundraising and the kids from your son's elementary school taping pennies into homemade cards to help out. It's being in the prayers of hundreds of truck drivers all over the country because your dad drives and his friends want to support him too. It's your mom and grandma taking care of your babies while you're 300 miles away from home, waiting for a chance that might never come. It's becoming part of a team, one in which everyone is intimately aware of what your body is doing on a cellular level. It's participating in that team because your medical care doesn't happen to you, it happens with you. But since our lives are not limited to family and friends, we brush up against the folks that care for us on a professional level. And because of the nature of transplant, making core memories with them. For example, Gina was the one to deliver the news that my transplant was a go, that lungs were here and we're gonna do this. I found out later that I was the first one she was able to give that news to. So I think that's kind of a special chance or special moment for both of us. And I will always carry Dr. Oren's teasing me at critical moments over the years, reminding me not to take myself too seriously. Like when my appendix ruptured, he asked, "Am I sure I'm not too old for this? And did I swallow gum?" Or mimicking my tacro shakes while admiring a blanket that I had crocheted after transplant. Or Lindsay, who is no longer at Hopkins, but she digs up just as many silly memories, like the time I broke my tailbone. She laughed entirely too hard, telling me I broke my butt. And her laughter was infectious. It's this kind of humor that steadies me and assures me that things are going to be okay. The team keeps me from falling into self-pity during hard times, and I cannot stress how important that is in this life. Terry is the most steadfast person I know. I will never forget her wishing me continued good lung function around my anniversary, because she used to work in a very depressing field, and she needed to protect her heart while still letting us know she cared. While Susan's quiet strength and calm never fails to center me in moments of doubt, or during those late night on-call phone calls, I hear her voice and I'm like, okay, we're gonna be good. And Dr. Shaw. I met Dr. Shaw when she was a resident, just a baby, and now she has been my doctor longer than any other. She is someone I trust implicitly and I admire for so many reasons. She always listens, even when she disagrees or I'm being a tad bit ridiculous, which is known to happen. She's collaborative and thoughtful and an absolute treasure to know. Her thread is the wide one in my personal tapestry, and I sure hope she'll put up with me for years to come. And I like to think that moments in relationships like these live as large in their memories as they do ours. That they help form the kind of medical professionals they become the same way it inspires me to live my life. And while we leave our mark in the form of clinical trials, our medical records documenting how we navigate this ever-changing landscape of pre- and post-transplant life, and leaving some very interesting medical histories for our future family, it's good to remember that we all belong to each other in this space. Take a look around the room. Here we are together, an indomitable group of survivors, caregivers, and in my opinion, the best team of medical professionals in the world. And that is something to be grateful for. Thank you.
Thank you, Sarah, so much. Well, this brings us towards the end of our evening. I did have some prepared closing remarks. They've gone out the window, so we're going to wing it. But really, it is, on behalf of all of us, on behalf of our entire transplant team, it has been our pleasure to host and put on this event. We have wanted to celebrate your milestones, your joys, your challenges, your triumphs with you, and so we are so grateful that you're here, in person, virtually, and it's just been an absolute joy and pleasure to take care of you. I do have some thank yous, so bear with me, because John said it takes a village, but it takes so much more than a village. So I want to start by thanking our donors, and thank you for Latrice for representing our donor families, and for all of you who recognized your donors or have had a chance to reach out to them and share your appreciation. It means so much to those families and gives them so much closure. So thank you again for all of our donor families and for all of you who have taken the time to reach out to donors. I want to thank our care partners who've come here today, who are maybe not here today. We know that your recipients could not have done this without you, that folks who are waiting, they rely on your support. And so for everything that you've done that we don't recognize enough, how much of a load it is, we really, really appreciate all of our care partners and all of the family that you guys have that really do all of the heavy lifting. To our transplant recipients, you guys have pushed through. You've been determined, resilient, dealt with unimaginable adversities, challenges, and kind of leapt into the unknown. You're here today. It's always been positive, but we know it's not been easy. And we are so grateful that you carry on with so much positivity, inspire each other, and help each other out. It really makes coming to work a joy every day. I think to our coordinators, our inpatient teams, our therapists, our RTs, surgical team, pharmacists, nutritionists, research team, scientific team, it is everybody. Everyone plays such a role. They do it so graciously, and they have dedicated to actually learning about transplant so that they can take care of you guys and your unique health. So we are so fortunate to have an incredible team. And as Sarah pointed out, some of our team has been here longer than me, longer than 20 years, because they love what they do, and they love taking care of you, and so thank you. I do want to take a moment to recognize a couple of people. The first, if I could have Brianna and Madison come aboard. They are two individuals who actually helped make this event possible. They did all the logistical planning and just told Errol and I where to show up. So we have a little token of our appreciation. So thank you. Madison is the administrative assistant for Division of Pulmonary Critical Care, and Brianna, as you know, is joined our team as our patient and event and physician liaison. I also want to introduce two other people, Gina Heckley and Carolyn Jelovich. I see Gina. Okay, come on over here. This event would not have been possible without the generosity of our donors. So some of you in this room, some of you that may not be in this room, all have given back really, really generously, supporting one of several missions. Our scientific mission and our research initiative so that we can keep transplants working better to have your lives get better and longer and healthier. They support financial contributions for patient hardships, knowing that you guys make incredible journeys. Medicines aren't cheap, sometimes a hotel, gas money, whatever it is. We've had a patient support fund for some of those moments, and we are really, really grateful to the donors who contributed. And for our staff, we like sending our staff to professional development, conferences so that they can stay up to date with the latest in terms of how to help your lives better and really stay up to date on how to take care of you. So I do want to take a shout out to those of you that have given really, really generous donations. Without this would not have been possible. If any of you would like to donate, you are more than welcome to do so in the future. Gina and Carolyn actually lead our development office, and they'll be here after at the reception. There's a little donor wall out there where you're welcome to make a donation or online. And we really, really do appreciate that for those who are in need. So I just wanted to introduce them and also just say thank you to the donor. All righty.